Students got the day off from school because there weren't enough bus drivers to get them there. Good evening, everybody. I'm Chris Katz. This happened in Sedalia, Missouri. As KMBC 9's Brian Johnson reports, COVID, bronchitis, and the flu were causing staff shortages.
Schools in Sedalia were empty Friday after administrators abruptly canceled class for the entire district. 13 bus drivers called in sick, nearly half their drivers.
It's every day, it's touch and go whether or not we're able to meet the healthcare needs of the community.
Up the street at Bothwell Regional Health Center, they too are seeing daily shortages of staff, supplies, and equipment.
And this is kind of a great example of reinforcement bias, where people hear the news that they want to hear.
Doctors say Pettis County is in the middle of a surge. This week there are 133 new cases of influenza, 255 new cases of COVID. Both respiratory illnesses that could be prevented by vaccines, masks, and social distancing.
That's been proven to reduce transmission within populations. Trick is to get people to be willing to do that, and that is quite difficult.
Friday, parents had to cancel work to watch their children.
And I'm just worried that could end up happening because COVID's still going on.
I'd like to see changes, but I don't think anybody's really going to change their mind about masks and vaccines and stuff. I mean, if they haven't gotten one now, they're probably not going to get one.
The district says it will complete an emergency.
We reached out to the bus company First Student for comment, but have not heard back. County officials say Omicron is not yet in the area, according to wastewater testing. Masks will be required inside all Park Hill School District buildings starting Sunday. School board members voted 6-1 on that tonight. The mask order runs through February 3rd, the same as Kansas City, Missouri's. 17 of the district's 20 schools are in Kansas City, Missouri. The North Kansas City School District announced today it too will follow Kansas City, Missouri's mask mandate for schools. Federal resources are here to help HCA Midwest Healthcare for patients during the COVID surge. It's a 15-member team from the Department of Health and Human Services. They'll help ease the strain on workers at Research Medical Center. Hundreds of staff members at Children's Mercy Hospital are out with COVID. 427 staff members have tested positive and are isolating at home, up from 119 yesterday. Doctors say staff members are pulling extra shifts to continue to provide critical care. They continue to urge parents to get eligible children vaccinated and take precautions with those who are too young.
Wear masks when you are out in public. Try not to go to large gatherings. And I think just be hyper vigilant and hyper aware of what's going on around you, and do everything you can to keep them safe.
Doctors ask you not go to urgent care or the ER for testing. You can go to childrensmercy.org to make an appointment for the hospital's drive-up testing. Doctors say at least 10% of people who get COVID develop long-haul symptoms, and there's a lot of research going on into why. As KMBC 9's Alan Chope explains, part of it involves a disconnect between brain and body.
This isn't a condition which you can push through and try to just get rid of the symptoms through exercising or anything like that.
Ashok Grupa is a COVID long-haul researcher. He monitors the effects of COVID and lingering symptoms.
It's very difficult to know what's actually causing the long COVID because it's happening in patients who have a very severe illness, who are hospitalized, right through to people who have very mild illness.
He says some COVID long-haul cases can cause responsive changes in the brain.
Initially, you may have a normal immune response to the COVID-19 infection. The infection goes away, but the brain stays stuck. It still believes that the infection is present because of the severity of the infection.
He says that's why some folks are experiencing long COVID.
We get ongoing symptoms where the body is essentially fighting a ghost virus that it thinks is still present in the body.
He says neuroplasticity works in a similar way with folks who've had an amputation.
Very similar to phantom limb pain.
Ashok treats patients with chronic illnesses, but since COVID, he says folks are confusing long-haul symptoms and chronic illness.
The hope is that people don't feel depressed and anxious about their long COVID symptoms, but realize that people do get better.
He says ultimately it's about rest and getting a lot of it and avoiding stress. In Kansas City, Alan Chope, KMBC 9 News.
Doctors say as many as 20% of children who get COVID have some short or long-term effects up to 8 weeks after the original infection. The president's vaccine mandate is now in the hands of the Supreme Court. Justices heard arguments in 2 lawsuits challenging those mandates. Justices must decide if OSHA has the authority to require companies with 100 or more employees to mandate vaccines or weekly testing. Liberal justices say yes because of climbing COVID cases. More conservative justices are more skeptical.
Most OSHA regulations, all of the ones with which I'm familiar, affect employees when they are on the job, but not when they are not on the job. And this affects employees all the time.
The court will also decide whether the government can require medical facilities to mandate staff vaccines if they're getting Medicare or Medicaid funding.